In this video, I'm going to be going through plantar fasciitis. Plantar fasciitis is inflammation of the plantar fascia. The plantar fascia is made up of thick connective tissue. It attaches to the calcaneus at the heel, travels along the sole of the foot, and branches out to connect to the flexor tendons of the toes. The presentation of plantar fasciitis is with a gradual onset of pain in the plantar aspect of the foot, on the bottom of the foot. This is worse with pressure, particularly when walking or standing for prolonged periods. There is tenderness to palpation of this area, particularly where the plantar fascia attaches to the calcaneus just below the heel of the foot. Management involves rest, ice, analgesia, for example, non-steroidal anti-inflammatory drugs or NSAIDs, physiotherapy, and steroid injections. Steroid injections can be very painful and rarely they can cause rupture of the plantar fascia or a condition called fat pad atrophy. Fat pad atrophy affects the fat pad over the heel of the foot, which is under the calcaneus bone. The fat pad normally protects the heel from impact. Rarely, specialist management of plantar fasciitis may be required with extracorporeal shockwave therapy or surgery.